perspective on this. When the AIDS virus was first discovered, it had almost a 100% mortality rate. In other words, almost everybody died of it within 5 years of the date of diagnosis. So from 5 years to 50 years is an incredible change in the mortality rate of this disease. There are a number of different drugs that are given for this. These are a couple of the different drugs. And you can see from these numbers here, 84%, 88 to 90%, 87%. These are the number of people who can take these drugs, and essentially their viral load is so low that they are almost negative HIV. Their viral load is so low that it's almost undetectable. So that's good news about that. One of the other drugs, and it's not within the PowerPoint, but it's something that you might need to be aware of, is that there is another drug out there that's called PrEP, P-R-E-P. PrEP is a pre-exposure prophylaxis drug. There are some people who take PrEP because they live a lifestyle such that they may get exposed to HIV. These would be typically prostitutes, sex workers of some kind, sometimes IV drug users. And so if you see somebody who is using this drug, then that means that they're at high risk for HIV and have opted to take this drug. PrEP is an extremely expensive drug. It's about $1,500 a month, so you won't see a lot of it, but it is out there. Some people do take it. HIV is somewhat similar to hepatitis C in that there are a number of tests that are really that are quick, they're very accurate, and we can find out in a hurry if a person has been exposed to HIV. The important thing, and these are a couple of names of it, OraQuick, Reveal, Unigold, Clearview, are just a couple of the different brand names of the tests. And the important thing about this is that if you do get exposed to HIV, there is a post-exposure prophylaxis that you can take that will reduce the chance that you become positive from HIV. The problem with the post-exposure prophylaxis is that it tends to cause a lot of problems. The people who take it have a lot of nausea, a lot of vomiting, a lot of GI upsets, and it can be difficult to complete the whole 30-day regimen. The nice thing about having these rapid tests is that it prevents you from being exposed, or prevents you from having to take the drugs for any period of time that you don't have to. And that can be important. So these are a couple of testing issues if you do get exposed. If a source patient is negative with rapid testing, then there's no further testing of the healthcare worker. I've got some old disease numbers here for HIV. These are from, I believe, 2011, and these are just a number of disease, or the number of people who are diagnosed with these diseases during the course of the past year, and they're not actually that high. The other disease that we're going to talk about is something that actually most of you guys are probably at a little bit higher risk for than some other things. And that's what's called methicillin-resistant Staphylococcus aureus, or MRSA. And MRSA is just it's a skin infection. It's a Staphylococcus skin infection. Everybody has the staph bacteria on their skin. It's a normal part of the environment in which we live in. The problem is that for whatever reason, some people will develop these staph infections on their skin which are resistant to antibiotics, and they can be difficult to treat. They'll usually show up with what looks like a spider bite or maybe a bug bite, an abscess, something like that, and they develop into a large infection that can actually go underneath the skin, into the muscle tissue, even into the bone if it gets bad enough. And if they're untreated, they can be fatal, although that's somewhat unusual. There's really no recommended exposure or treatment needed for MRSA, MRSA. The most important thing about MRSA is basically keeping your work area and your workplace clean. One of the places where a lot of people get exposed to MRSA is in gyms, exercise mats, the machines downstairs in the gym. Those are breeding grounds for MRSA. Be good to the people who are working out behind you, and just make sure you clean the machines after you use them, and go ahead and wipe them down before you get on them, just in case. Over the years, one of the things that we've had a lot of questions about is tuberculosis. There was a goal to eliminate tuberculosis worldwide by 2015. That has not happened. In fact, there is some evidence that shows there is some uptick in the number of tuberculosis cases. A lot of our homeless population are coming up as being positive for tuberculosis. Lots of reasons for this. They don't have access to good medical care. A lot of the homeless shelters are very crowded. There are a number of people living there, and so the TB bacteria just gets passed back and forth from one person to another. We're going to talk a little bit about the various modes of transmission. The first one we're going to talk about is contact exposure, and there are two distinct types of contact exposure. The first one is a direct contact, when a pathogen is passed directly from one person to another. And the second type is an indirect contact, in which a pathogen is passed by touching a infected surface or any kind of infected material. The next type of exposure is a droplet exposure, in which pathogens are expelled through coughing or sneezing, and then they're inhaled by another person. And then the last type of exposure is when pathogens enter the respiratory tract as microdroplets. There are various things that we do that will expose us to this stuff. For direct exposure, you could get a direct exposure when you're providing first aid to a subject. Being bitten by a suspect is a direct exposure. Indirect contact is a little bit different. That would be something like processing evidence, any type of a surface contact. Actually, a needle stick, because it's in that inanimate object, is technically an indirect contact, not a direct contact. And then droplet and airborne exposures you get simply from being there. How do you minimize the risk of any type of exposure? The absolute most important thing that you can do, and it's up on this slide right now, is to wash your hands. Wash your hands a lot. Wash your hands before you go to the restroom, after you go to the restroom, before you eat, after you eat. If you're in a position, if you're working in the field, when you don't have ready access to soap and water, make sure you've got some of that waterless hand cleaner with you. Keep it in the side pocket or in the console of your car, and use it as much as you can. Standard precautions are precautions that you use in all situations where blood or other potentially infectious materials are present. In addition to hand washing, that would be something like wearing gloves whenever there's a possibility you might touch something. Transmission-based precautions are used when you know people are infected, and you use them in addition to the standard precautions. And then you've got to make sure and follow your work practice controls, which are just a policy and procedures that cover this type of thing. Standard precautions: avoid contact with blood and other potentially infectious materials whenever possible. Wear disposable gloves. The gloves that we should use are the nitrile gloves, not latex, not rubber, but nitrile gloves. And then use your personal protective equipment, or PPE, whenever it's warranted. Wash your hands, dispose of contaminated PPE properly, and clean and disinfect whatever work area you may have. Transmission-based precautions, you're more likely to run into that if for some reason you have to take care of a prisoner at a hospital or guard a prisoner. And that might be something like a respiratory mask, isolating an infected person, or using some particular type of cleaner to keep an area clean. Work practice controls, don't eat, drink, or smoke whenever there may be any kind of contaminants present. Don't apply makeup or lip balm or anything like that in a contaminated area or a crime scene. Don't store food in any kind of a refrigerator where blood is being kept. Personal protective equipment, the primary one is always going to be the gloves. Like I said, nitrile gloves, just to make sure you don't get anything on your hands. Gowns, we very rarely use gowns. About the only time you'll be using gowns is if you've got to guard somebody at the hospital who may have MRSA or something like that. And then masks. And again, we rarely use masks. They are less effective than most people think they are, and they come with their own set of problems. Eye protection, we probably don't use eye protection nearly as much as we should. Glasses, regular glasses, do not constitute eye protection. You have to have the glasses with the covers on the side to prevent stuff from splashing up around them. If you work on patrol, if you're in the field a lot, I strongly recommend you check into some of the lenses that wrap around your eyes to provide a higher level of protection. There are a couple of them made by Wiley X, I think is one of them, and I think 511 makes some too, but I would strongly suggest you look into something like that if you're going to be working in the field a lot where this may be an issue. And then CPR shields. Gloves, worn whenever there might be a risk. Wear them even if you're not aware of any cuts or anything on your hands. When you take them off, make sure you wash your hands. If you don't have soap and water available, use a waterless hand cleaner. Should be disposed of properly and should not be reused, although I can't see anyone around here reusing gloves. Gowns are used to protect clothing from contamination, and you should be using them whenever there's any possibility of splashing of blood or any kind of potentially infectious material. And again, dispose of those properly as well. And we will go over the proper procedure for disposing of infectious material towards the end of this when we cover the policy. Masks. The only type of masks that we use are the regular surgical masks. We do not use the N95 masks. I can't foresee of a situation where you would generally need to wear an N95 mask. What I would suggest is that the next time you see any of the guys on the medic trucks, see if you can get in touch with them and get some of the masks that they have that have got the eye shield that goes with the mask. And those are nice little masks. They go over your ears. You don't have to tie them behind your head. So they go on easily. And when you put those on, they'll also protect your eyes. Those are good if you've got somebody who is coughing and spitting on you. Eye protection, like I said, glasses don't count. They've got to be have the wraparound protection. CPR shields used whenever you're doing rescue breathing. A pocket mask will work. An ambu bag is even better. If you're working in one of the pods at the jail, there should be an ambu bag with the AEDs. Packaging and disposal of this stuff, especially if it's a sharps container or a sharps and needle that you're trying to dispose of, it's got to go in a sharps container. It's got to be labeled. It's got to be non-penetrable so the needle cannot stick through the container, and then you've got to dispose of it properly. This brings us up to our exposure control plan, and Lieutenant Carpenter, if you can hand me my phone, which I left on the table, there are a couple of things that I want to talk about on this. And this is the, thank you sir, this is the administrative stuff that probably nobody's going to pay an awful lot of attention to, but it's got to be reviewed annually, it's got to be updated, everybody's got to be offered the hepatitis B vaccines. You need to get all 3 of them. And there needs to be a contact person for any kind of an exposure incident. The contact person, I believe, is me. It was a few years ago, and I don't know that it's changed. Here's what you're offered from Durham County government and compliance with federal law. In case you get exposed, you get medical evaluation and you get follow-up care. That's the only thing that you are entitled to. Supervisors, sergeants, lieutenants, corporals, this is the way it works with our exposure control plan. If you have got an employee who has been exposed to something, there's been a non-intact skin or a mucous membrane exposure to any other person, that employee has got to go to Corvell for testing. The person to whom they've been exposed, if there's no record of any pre-existing condition, they also need to be tested. There are a couple of different ways we can do this. The easiest way is if that person is in custody, then when they go to the jail, take them straight up to medical, make sure medical knows what's going on, and then the medical staff can draw blood, send it off to be tested, and then we get the medical staff at the jail who do the testing to contact the people at Corvell, and they can coordinate whatever kind of treatment needs to be done.